Welcome, everybody. I'm Matt Seefeld. I'm the Executive Vice President here at MedEvolve, and we're excited to talk to you about preparing for the COVID-19 rebound. With me today is our CEO and President, Matt Rolfes, and our SVP and Chief Operating Officer, Craig Haskin. We're going to talk about quite a few things today. Our focus is really going to be on the concept of a virtual workforce. We're going to be talking about the technology to measure effectiveness for staff production, which is an important topic. We're going to look at touch-free financial clearance and what that means and why that's so critical in today's world. We're going to look at ways and tactics and how you make sure that you minimize your cost to collect. And most importantly, protect that net revenue. It is going to be critical when we come out of this rebound that we are very lean, we're very agile, and we're very protective of every dollar we bill. With that, I'm going to hand it over to Matt Rolfes, our CEO, to get us kicked off.
Thanks, Matt. So just to kick off, we want to make sure we're aligning with what the recommendations are that are out there from the AMA. So as we go through this presentation, you're going to see a lot of the same themes here as you see here with the yellow highlighted items. A lot of this centers around making sure that we have good visibility and transparency into what is going on in our practice, and really how to kind of leverage some of the assets that we have, and also finding some new opportunities out there that can help us navigate through these waters, and then also have some ability for the next possible crisis that may come about to be able to navigate through those waters as well. So the first step is really trying to understand and accept what your status is and what the reality of your situation is. And then also make sure we understand, what the impact of the current crisis is to your practice, and then what your model will look like when you come out of the crisis. You are going to have some cancellations. You're going to continue to see cancellations or slowness in terms of getting your patients back on the schedule. One of the key concepts too is knowing that your revenues are going to drop faster than your expenses will. So knowing that that's probably going to be a fact, we need to make sure that we have the ability to scale organizations. And then the next thing really is to understand, what decisions need to be made during that process. Some of the things you need to start off with are reducing your variable expenses. So we need to take a hard look at some of those expenses that aren't necessarily a need, but maybe luxury items that we have on our P&L, but also things that may scale up and down with volumes. So let's take a good first look at those things. That's kind of your low-hanging fruit. Next was really looking at your vendors and looking at your fixed overhead and seeing what you can do to actually work with your vendors to defer some of those costs or reduce some of those costs for a period of time. And usually if you reach out to them and you try to work with them, and they've been good partners with you in the past, typically they will work with you to either defer those or reduce those costs for a period of time. Next, we kind of get into some of the more uncomfortable things that you may have to discuss. Your staff obviously are probably one of your largest, if not your largest expense. And some of those employees may have been with you for a long time and are very important to the practice, important to the doctors. So obviously that's not something you take lightly, but because that is such a large expense, we're really going to have to take a good hard look at those things. And then lastly, really talking to the providers, a lot of your stakeholders, the ones that are owners in the practice, those types of things. How can they contribute to softening the blow of a downturn? And sometimes that may be either reducing their disbursements or deferring their disbursements for a period of time. And we kind of look at this as basing our decisions on facts and not feelings. We have to really accept the reality of our situation and then start making very deliberate decisions about how we address the problem. Our goal in all of this is to make sure that we have a practice or have a business after the crisis is over. One of the key things here too is that crisis can actually also be an opportunity. One large factor that's really helped MedEvolve, and I know has helped a lot of our practices around the country, has been converting to a remote work environment. So when you can't have your billing staff in the office for whatever reason, they can continue to work outside of the office and remain productive. And you can scale your employee costs with those changes in revenue that we know that are coming. We can also monitor what those employees are doing, what their productivity is, and what their financial outcomes are. So you have that full transparency in what is going on in your business office, which is going to allow you to address the crisis at hand. Or when you look into the future, you'll have a much better, more scalable, centralized business office than what you do today. So these are things that can really help you refocus your organization on what the new normal is going to be and what actually might be a better new normal than what you had before.
Matt, on that, just to comment real quickly, clearly part of the backdrop of putting the right model in place is having a good forecast. And we addressed that earlier in our first webinar. So that's probably something for those listening is how can you get an accurate view of what your cancellations are, what your workload is. And then the second part, I mean, Matt Seefeld, I know that you speak to this all the time, but transparency to the workforce, you can tell when you go remotely, if you don't have transparency of what your team's doing with some automation, that's really what's going to hamper you. So these are the tactical pieces, but really the technology around this is something that needs to be brought to the forefront because you cannot plan to do this move without having some degree of transparency. So just want to comment quickly on that because I know that is what made our success such a success. So clearly the framework about what Matt was describing is really the preparation for this recovery. This is the summer when things get back to normal, possibly 20%, 50% volumes, who knows? But how do you prepare for that? Because significant revenue loss has already occurred. You've had to make drastic cuts to address your variable costs or your fixed costs. It's not just how did you weather the storm, but how does this become the ramp up and how you go forward? You've already made difficult decisions around your staff. You may have all-in-one skills where you have someone doing coding, charge entry, and payment posting, and even AR follow-up. But in the scalable model, you're going to have to look at, if you've got several staff, can you bring back fractional people? And really, that's the downside of fixed costs, is these resources are with families and with children and with a need to have full income. So you can't afford just to bring 10% of a resource back. So how do you move that fixed cost to variable? How do you reduce the cost to collect to basically develop a linear, scalable model that can ratchet down to a 20% revenue and also ratchet up to 100% revenue?
Yeah, and Craig, you nailed it. And I'll give you a couple real life examples that we've had to deal with over the last 8 weeks in our revenue cycle management department. We built forecasting models out. These forecasting models allow us to understand the rate of change of charge entry, for example. So we started to see that obviously decline materially after March 15th, and that carried all the way through April. We're now just starting to see a slight uptick across our clients, which is a good sign. The challenge is the volumes are coming back, but because so much is converted to telemedicine now and office visits that the actual revenue, right, top line revenue and net revenue is not coming back as fast. And so we have to be very careful with how many charge entry coders we're bringing back. At the same time, we've got to be looking at payment posting. I had a discussion with our vice president of revenue cycle yesterday, and we were talking about the fact that now we're seeing the impact to our payments. So our payments are down a material amount. So therefore, could we shift a payment poster who has some skill sets for maybe AR follow-up, has some skill sets for data entry, charge entry? Could we move those around? And these are real-time decisions that we're making because we have to, as Matt Rolfes said earlier on, we have to make sure we're around when the rebound comes out, right? We service a lot of clients and we can't afford to be out of business. And so for us, we have to do this. And our clients are demanding this type of insight because they're making those real-time decisions too. And if COVID or whatever that next crisis is comes back, the market's going to demand these things for all of our sakes, right? And so I really want to be steadfast on those points. Yeah, and keep in mind too, insurance companies are in this chaos as well. And so we're already seeing average days to pay go up. We're seeing claims have more delays, longer hold times. Things you just didn't think about back in February are now impacting the revenue cycle. So let's talk about financial clearance. A lot of our workflow automation technology started in the back office, and then we've now started to move a lot of those to the front office, because at the end of the day, if you don't get it right up front, you're going to have a lot more cost in the back end to try to overturn denials and get paid what you're supposed to be paid. So, when we look at financial clearance now amidst COVID, right, one thing's been taken away from us, which is the waiting room, and that's a scary place for a lot of provider groups out there because a lot of provider groups still rely on the waiting room as their way to make sure patients are financially cleared. I was talking to a couple of clients this last week that still think that it's okay to verify insurance the day of the appointment. They still think it's okay to try to collect past due balances and patient liability at the front desk, when there's lines of people that are still trying to check in for their appointments and get their paper forms filled out, et cetera, et cetera. So we did a webinar recently on the virtual waiting room, this whole concept of getting all of that work done before the patient ever shows up. In fact, what we're seeing a lot of our provider groups are looking at models where, you show up, you get to the parking lot, and you wait till you get a mobile text, an email, or a phone call, and you're escorted right back to the physician's office. There is no more front desk. There is no more chance to get it right. And if you don't get it right, and you can see some of these bullets here, right? If you don't do these things in this day and age, your net revenue is going to be materially impacted. And right now, with how tight cash flow is and how tight margin is, you can't afford to lose 1%. You can't afford to lose 2%. You've got to make sure that you minimize your bad debt and you minimize your avoidable write-offs. And in order to do that, you got to have technology that makes sure that your teams are held accountable, not just for production, but the financial outcome. And you have to have analytics to hold them accountable, right? You have to have analytics. It's, for example, we look at, where if somebody says they verified benefits and eligibility, and we see a first pass denial on the back end for COB eligibility, we tie that to the representative that said they did the job. And that real-time feedback loop is critical nowadays to make sure that people's behaviors change and that you're steadfast in your mission to clear patients before they are seen. You just don't have an option anymore to wait the day of.
Hey, Matt, I think one important note here is at the bottom where we say, while maintaining a positive experience for the patient. I think just in this day and age, what we're going through right now, having the ability to work with patients prior to them walking through the front door, especially those that may be in a group that may be more susceptible to the virus that's going around right now. And I think they'll really appreciate the fact that if you're reaching out ahead of time and clearing them while they're at home, while they feel safe, or working with them and coming out of the parking lot instead of having to sit in a group setting in an office, to me, I think that would be a very, very good customer service benefit to this process.
Yeah, I absolutely agree, Matt. And one other thing that I'll just say, and I said this to one of our largest clients yesterday when we were talking about installing virtual waiting room in their organization, is part of this is on the clinics to make sure that they hold patients more accountable for this new world, right? And so you have to set the expectations with your patients that when they schedule appointments, they will be expected to be financially cleared before they ever show up to the office. And for some clinics, that's a hard thing to handle, right? Because in the old days, it was okay to have a sort of model when it came to financial clearance. But nowadays, you have to set those expectations. And you also have to set the expectations if we can't get you financially cleared, we can't get some of these bullets handled, that we may have to reschedule your visit. And that's not just for us, that's for you as well. Right? We don't want surprise billing. We don't want avoidable denials. We don't want those things which are going to hurt the practice, which in turn down the road could result in the practice closing down or the practice having to sell to a hospital, and it would impact the community. So again, this is a macro event that's going on, but I also think that this macro event of COVID has allowed us to relook at our entire revenue cycles as provider groups, and in our case as vendors that provide a service to provider groups, and start to say, hey, there's no more patience when it comes to doing things wrong in the revenue cycle. And there's no more patience when it comes to allowing people to not be held accountable for the jobs that they're doing and the financial outcomes they're getting for the organization. So on that note, let's talk about transparency. So one of the things that we had to do here at MedEvolve, it's coming up actually about 2 years ago when I took over a revenue cycle, is I wanted to understand what our people were doing and what the financial outcomes they were getting. And I wanted to see who potentially needed some additional training. I also wanted to be able to assess quickly if maybe folks were in the wrong roles. Is that you may have someone that really wants to do a good job, but they're not capable. And it's not because they couldn't be trained up eventually. It's because there's something better along the revenue cycle that they're good at. Maybe it's a payment poster that should have been an AR follow-up rep, right? But the key is you have to have the transparency. And I talk to clients and I still hear we don't really know what they're doing, but they've been here for a long time. And we do have reports, but it's run monthly and it's really hard to keep track of this. And that world's gone. If you're listening to this webinar and you're like, wow, I don't even have any insight into production, or you're saying I sort of have insight in production, but it's like a monthly or even a weekly thing, you got to have real time. And what I mean by real time is like it's got to be in front of your face so that you can make changes. And the staff actually will eventually appreciate it, not necessarily out of the gate, because they're going to start having a competitive nature. And they're going to say, hey, I am being watched and now I'm being valued. We actually have an incentive-based revenue cycle here at MedEvolve. Our people who perform, they get financially incentivized to do it. And I can tell you right now, very few months are missed. These folks, they want to do a good job. They're proud of the job they're doing for our clients. Our clients are happy because their financial positions are better than they've ever been. And so you have to really look at these bullets. These are just examples, by the way, that we're talking about here, but making sure that you have a complete accounting of your AR, making sure that your coder production is where it needs to be, making sure that you understand the last date that for surgery, for example, we want to understand not just, is our charges going out, but do we have a backlog in getting coding done to get charges out? If it's more than 2 days, it's unacceptable. We want to make sure we understand the value of the AR that's being followed up on. We want to make sure we protect against timely filing. We want to understand when people are working. We deployed, as Matt Rolfe said, we deployed an at-home workforce in 24 hours. And we were able to do that because we have ways of workflow automation. And we have analytics that allow us to look at every segment of the revenue cycle that we're responsible for our clients. And this is real-time information. So we do know that even though somebody's been put at home, we know when they're logging in, when they're working, how many claims per hour they're working, and then we're able to have constructive conversations with folks. So again, this isn't just about being Big Brother. This is about making sure that you're paying individuals to manage the most important part of a provider's world, which is your revenue cycle. And so I highly encourage you look at your people, you look at the willingness and the capability, you consider cross-training if needed. You also look at the ways you incentivize people. So we're all about transparency, we're all about workflow automation, right? Those are the two things that have evolved here at MedEvolve in the last 2 years. And it's evolved out of necessity, but it's also been accretive when it comes to our clients' profitability. And even our clients who don't outsource the revenue cycle, they're using these tools and technologies now to make sure they're managing effectively and they're getting the results they want. When we redesigned our entire revenue cycle 2 years ago and we built all of this AI-driven workflow automation technology and analytics tools, these are the results that we're seeing. There's no magic wand here. It's simply looking at people and process and aligning the right technology with people and process to get these types of results. Again, you got to look at this opportunity here with this crisis is to recheck your entire revenue cycle. And if you outsource your revenue cycle, recheck the vendors. Make sure you have the transparency real time into how well they're performing. Make sure your vendor is putting the same level of accountability on you. We always make the point here at MedEvolve, and when I say this to new revenue cycle clients, I say our transparency tools are for you to know real time how well we're doing, but it's also for us to know real time how well you're doing. And I can promise you we hold every one of our clients accountable for financial clearance because I can only do so much on the back end. I got to have margin there to support a business. And the only way I can do that is to make sure that we're minimizing our avoidable write-offs, we're minimizing our bad debt, and we're collecting every dollar in available cash out there.
Matt, I think that's an important point for us internally in having a margin crisis. We knew we had to change and we made the changes necessary. We developed the technology necessary to facilitate a material increase in our margin, which I think there's really a good translation to what's going on today with COVID-19. Having the opportunity now to make some changes that maybe you've been putting on the back burner for quite a while, you can implement a lot of those changes now, having some bandwidth, but also just out of necessity, having to change to fit to what this new normal is. While it's a terrible situation, you still can capitalize on the situation and come out better and more efficient when this is all over with.
So really, that first point is a big part of what we've kind of said at the start, and we want to summarize here is how do you tie your revenue and expense to where you can scale to what has already been a downturn. And clearly, that's something that you've had to make tough decisions on. You may be doing payment and charge entry as a practice admin right now because you had to let your entire staff go. But instead of looking at doing the business the same way you've always done it, this is a reset opportunity for you. What if you had the ability to proportionally scale your costs to your revenue for your practice and for your physicians? Obviously a game changer. Transparency is the only way that works. And so at MedEvolve, we have a scorecard that really brings that out into daily, weekly, monthly comparison. So are we at or ahead of schedule or at or above the trend line? That's the measurement that you have to have. Facts are what's going to drive improvement. And then the last part I'll say is many times our clients have looked at key resources as a downside. Not necessarily. What we've proven out in our remote workforce model is your key resources very likely may be our next hire. And so when you're looking at key people that are in key positions and you can't afford them based on a 20% volume, moving them to a shared service model, which in essence is what we have, allows that resource to flourish and allows you to get that scalability at that 10 and 20%. But as we go forward and ramp up, it's going to be more than just one resource, it's the delivery model.
Craig, I know you and I both talked to a lot of our clients over the last 6 to 8 weeks, and Matt, I know you have as well. And there's an emotional toll on providers having to furlough and then bring folks back on and then potentially furlough again this fall if COVID comes back with ferocity. And we've seen a big uptick in clients coming to us and asking us to take over revenue cycle, especially in the last month. And I think that's a big component of it, is that as long as you have the transparency, the analytics real time, delivered to you to make sure that, for example, we're doing the best job possible and potentially even rebadging employees, qualified employees that meet our standards. You focus on what you do best, which is delivering care. And let us, for example, or an RCM company that you trust, manage the financial piece. We're all human. We've got something going on right now that's impacting directly or indirectly all of us. But when it comes to revenue cycle, you just have to make sure that it's being managed appropriately and you're as lean as you can be. And you have such little room for error now. And I think that this tragedy that's happening is really starting to make some of our provider groups realize that.
So really kind of boiling things down to where, we think the new normal is going to be is really that virtual workforce being able to move from an in-office situation, to the home in a quick amount of time is a good asset to have. Technology is something we've made huge investments in that really allows us to monitor our staff, make sure that we're getting the most for every dollar that we're spending for productivity. And then going into the touch-free financial clearance, that's going to be ever present as the COVID situation progresses. But you still have to get those patients through the door, and they still have to have a good flow coming in and out and good communications. So, getting into kind of where we want to go in terms of forward, using the current situation to make material changes to the organization. Like I said, how do we get the most production for the lowest dollar that we can spend? We're going to continue to see pressure on margins. So what can we do? What technologies can we bring into place? And then how can we align our people around those new technologies and processes? And ultimately, all this is going to go into protecting your revenue. It's going to be very, very important for us as we come out of this to continue to move our missions forward collectively and, continue to be that pillar of the community that we serve. So if you guys would like to learn more, we are always open to talk to you guys and help you through some of the solutions that we provide. And we would like to know more about you as well. So if you need to get in touch with us, you have some contact information here. But we all are all in this together, and we hope for a quick resolution to the crisis. But hopefully the end result is we have a more efficient, effective business and a more efficient, effective practice as we come out of this. So thank you, and we wish you a good day and good health.